Congressman Mark Pocan is with us. He, regular on our program. I think needs no introduction, I think, beyond that. But Congressman, you have an announcement.
Yeah, well, this is something, Tom, I think, for a long time, your listeners have brought up this subject, and we've had a great conversation about it, about, the problem with some of these Medicare Advantage programs, the fact that they're not Medicare. Often they're shortchanging people from getting the actual care they need. And now I think a full majority of people in this country, or over half the people on Medicare, are on these Advantage plans that are really substandard. And so we had a lot of conversations and decided the best way to try to approach this would be to ban the use of Medicare in the names of these plans.
The word Medicare.
They can't be, so they can't be Medicare Advantage. They can be whatever they want to be, Blue Cross Blue Shield, whatever company has one. They can call it anything but Medicare. But only Medicare is Medicare. And we want to preserve Medicare because it is the best program that's out there. We should certainly try to improve it. Let's add dental and vision and hearing and other things to it. But to have this separate programming that doesn't provide the same quality of care as Medicare is something that I think a lot of people don't know about. And I'll be honest, Tom, my mom was one of those people. She passed in February. And when she was in assisted living a couple of years back ago down in Kenosha, Wisconsin, they identified some care that she needed that someone actually came right into the building and could have provided for her. But because she was on one of these Advantage programs, she couldn't take advantage of that. Only Medicare was going to take care of that. She would have had to leave the building to get some of that regular care, and she was not especially mobile and wound up not getting the care she needed. So, this is a story and probably one of the lesser stories of what some people have had. If they're out of network in one of these plans, they can get billed really big expenses. We want to make sure that we're doing everything possible to preserve, protect, and enhance Medicare. Medicare Advantage programs certainly don't do that.
So the legislation is called what?
Save Medicare Act.
Okay, and it is so far sponsored by?
Right now, it's Khanna and I. So again, I think it shows how much this comes out of your program, Tom. The two members I think who are on the most having conversations talked about this. But to be fair, I think this is something that a number of us have had talks about, from people like Pramila Jayapal and Jan Schakowsky and Katie Porter and many other members. We've been on calls at various times with CMS on some of these privatization schemes, and I really do believe there's schemes that are out there. But this bill, I think, is the first ever introduced to kind of go after this, right, to make sure that they can't get away with this. And I think the most direct way to do that is let's just take away their ability to pretend that there's something they aren't, which is Medicare.
Yeah, I think, George Bush wanted to privatize both Medicare and Social Security, and he privatized Medicare in 2003 with Medicare Advantage, and he failed with Social Security in 2005, and I think it's because the health insurance companies were slick about marketing. They knew if they could just borrow that word Medicare, they'd be in Fat City. But the banks who wanted to privatize Social Security, they did not come up with a marketing scheme of, like Social Security Plus or Social Security Prime or something like that, And so when Bush tried to say, well, we just need to privatize Social Security, turn it over to J.P. Morgan Chase, people said no. but I think this is so important. What can people who are listening to our program right now do to support your legislation and to get their members of Congress to sign on to it?
Sure. Well, two things. One, to get people to sign on, you can reach out to your member of the House and Senate, or the House, I'm sorry, it's a House bill, and say, hey, a bill just got introduced called Save Medicare Act. It preserves and protects Medicare. I hope you'll take a look at it and consider signing on. That's probably the most important thing. But secondarily, over the weekend, the New York Times did a great piece on this, and everyone should take a look at it because in a very short format, you can find out what a scam some of these groups are. Not only are people not getting the care, Tom, as I know you know this very well, but 8 of the 10 largest Medicare Advantage insurers submitted inflated bills to the federal government. 4 of the 5 largest have faced federal lawsuits for overbilling that have crossed the line into fraud. There's $12 billion in overpayments, they think, in 2020 alone that went to these programs from the federal government. So this is taking away money that should have actually provided health care to people. If you think about that $12 billion in overpayments, how far that would have gone to cover dental, vision, and hearing and other benefits we could have had. And I think that's the issue. So, get informed on the issue. That's you've got a great book that mentions this, and I've read that. But also this article this weekend, because it's so fresh and has some really concrete examples, is a good article for people to be sharing with their members of Congress as well, because it lets people know that it's not just a phone call, but they're an informed constituent.
Yeah, it is, and one of the really brilliant points that the authors of the New York Times piece over the weekend point out is that just the money that these health insurance companies have basically stolen from the American people by running the Medicare Advantage scam was enough money. Had Medicare been able to hang on to that money, it was enough money to pay for dental and vision, and maybe hearing. I don't recall, but I recall the dental and vision for sure. Correct me if I'm wrong. For literally every senior in the country. I mean, it's just amazing. The phone number for Congress, the Congressional Switchboard, is 202-224-3121. And I'll give that again in just a moment for people who might want to write it down. You can also, of course, whoever your member of Congress is, if you know, typically the protocol for their website would be member.house.gov. So it's like pocan.house.gov for your website, where there is a press release that people can find about this.
It's brand new, Tom. Today we introduced it. So, legitimately, people may not know a lot about it. So, just realize that when you call. And the other thing I think it's fair to put out there, Tom, is, in some cases, if you're on the younger end of receiving Medicare and you're healthy, often what these plans do is they'll offer something additional that you don't get with Medicare, like vision, right? Or something
gym
like
membership,
that.
Yeah.
Yeah, just to get you in. But the reality is that means now you're in their network and you can't go to anyone that takes Medicare. Now you have to go only to their providers. And that's the part of the problem is then, it could be if you're away from home and that network isn't there, what are you going to do? In the case of my mother, when, she's not especially mobile, she couldn't then get the very health care she needed because it wasn't covered by this Advantage program. I think that's the part that people just need to know, because I'll bet you there are some people who are pretty happy with the plan they have, but it may be because of their current conditions. And in reality, overall, this plan has had quite a bit of problems, from the overbilling and the scamming by the companies to the lack of service for many, many, many people who have them.
Yeah, it's because they haven't gotten sick yet, and so they don't know. And this came up yesterday on the program, and I was just astonished. We had 3 or 4 callers who were talking about how they had brought this topic up with friends or family, and 100% of the time, those friends and family asserted strongly that they were on Medicare. Yes, I'm on Medicare. Of course I'm on Medicare. Here's my ID card. And you look at the card, and it's Anthem, or it's United Healthcare. It's it was an Advantage plan. They thought they were on Medicare, and they had Medicare Advantage, and it's just amazing. So the phone number for Congress, and this will get you to the Congressional Switchboard. You can simply say, "I'd like to speak to." I'm not even sure who my member of the House is, but I live in Oregon, and my zip code is 9721, whatever it may be. That's all you have to do is just tell them, and they will tell you who your member of Congress is and connect you directly to them, and then tell them, that member of Congress, or tell their office, that they should be supporting the Save Medicare Act that was introduced by Congressman Pocan and Khanna today. That number is 202-224-3121. And Congressman Pocan, you're doing God's work. Thank you so much for this, and thanks so much for dropping by and sharing it with us.
Well, thank you, Tom. And again, I mean, I know I enjoy so much having our regular town halls with folks, but we listen, right? Members of Congress, we're listening to the issues, and this came up a lot. And I don't think this would have been introduced, or we're also trying to look at a perspective of having an audit as well done by the GAO to try to get at a few more of these issues. But it happened because your listeners are active, because you, Tom, are very well informed on these issues. And I just want them to know that, their voices are heard and they've had an effect.
That's great. Congressman Mark Pocan, pocan.house.gov. You can tweet him at Rep Mark Pocan. Congressman, thanks so much. Once again, it is the Save Medicare Act, right?
Yes.
Yeah,
that's
okay.
it.
Save Medicare Act, and call your member of Congress at 202-224-3121. Congressman, thank you so much for dropping by.